Hello and welcome to the Knowledge Sharing Webcast. We have just a few announcements before we begin. The slides will advance automatically throughout the presentation. To enlarge the slides, click the Enlarge Slides button located above your presentation window. Should you need technical assistance, click on the Help button. If your screen freezes or the slides do not appear to be advancing as they should, please try exiting and restarting the session, as there may be an issue with your connectivity. At any time, you can submit a question using the box on the left-hand side of the screen. I would now like to turn the call over to Jen McNeil so that we can begin.
Thanks, Russ. Welcome to today's webinar. Patsy Beattie-Huggan will be our presenter today. She is the president of the Quaich. I'll give you a little bit of a history on Patsy just before we begin so you have a better idea of her background and where she's coming from. Patsy has a master's in nursing studies from the University of Edinburgh with professional experience in nursing education and management, senior management in the PEI health system and health promotion, community research and development. Since her diagnosis with breast cancer in 1996, she's worked in breast cancer as a researcher and a facilitator. And through her company, the Quaich, she has worked on many healthcare-related projects. In a volunteer capacity, Patsy serves as chair of the advisory committee of the UPEI Breast Cancer Research and Education Fund, and also served as a board member of the World Conference on Breast Cancer Foundation. She continues to promote a holistic approach to health and the creation of more caring, compassionate communities through such tools as the Circle of Health, having served as chair of the Four Neighborhoods Community Health Center and coordinator of the Atlantic Summer Institute on Healthy and Safe Communities. Patsy and her husband Lyle have 2 children and 2 grandchildren. So that's a bit of a history on Patsy Beattie-Huggan, and on that note, Patsy, I'll turn it over to you.
Thanks so much, Jen. Really good to get started on this and look at this particular topic, which is a bit daunting, actually, to try to prepare in some ways. It's not exactly specific to breast cancer. It's really much broader than that. So I went to another knowledge source to really look for this information. And this is the whole area the whole presentation will really be built on some research that was done through the Atlantic Summer Institute on Healthy and Safe Communities, and I'll talk about that in a little bit. So some of the questions that many people have when we get into these words of knowledge sharing, that would be fine, but we then get it confused with knowledge exchange, knowledge translation, and knowledge uptake. And my sense is that many people find these words confusing, especially when funders are talking about the need for knowledge translation and asking that proposals build in opportunities for knowledge exchange and knowledge translation. So if you folks who are on this webinar are confused, just to let you know, you're not alone. So how do you go about actually setting up an environment that is supportive of sharing knowledge amongst people of different backgrounds? And most people are looking for some tips, and I'm assuming that you may too. And you may be looking for a model that you can use to sort of a cookie-cutter approach that you can use to actually guide you when you're sharing, exchanging, or translating knowledge through different age groups and cultures. What vehicles work? How do you go about it? Is there some particular way that there are a best practice that you could use? And how would you ever know if what worked and what didn't work? And are you looking for ways to evaluate what you do that works? If you're asking yourself some of these questions, then this webcast is for you. It's designed for people who are navigating the language of proposal requirements or setting up educational opportunities for people who come from different cultural, professional, or educational backgrounds. And that could be, when I say educational, I don't mean a formal education. I really mean that opportunity to come together and listen to each other and have a consultation. So any of those kinds of types of approaches would fit under educational opportunities, in my books anyway. A little bit about who I am. You've heard from Jen, and just to give you some sense of my company is the Quaich, and that's its logo. I do coordinate the Atlantic Summer Institute on Healthy and Safe Communities, and we're hosting the 6th summer, and also have been doing work this year with the Canadian Breast Cancer Network as a facilitator and evaluator. So there's some reflection on all of those experiences as we go through this presentation. There is a chat box just before it gets started. There is an area at the bottom of your screen where you can ask a question if you so choose, and please do that. If at any time you want me to stop me to ask a question, just write it in, and Jen's going to be watching those questions and fielding them to me. So please, that would be the best way. And otherwise, I have built some question time in at the end of the presentation. So this webcast, as was in the descriptor that was sent out to you, has been drawn from a synthesis paper on cross-cultural knowledge exchange that was completed in 2009 by the Atlantic Summer Institute on Healthy and Safe Communities. It was based on a project entitled Bridging Differences, Learning Together for a Healthier and Safer Atlantic Canada. And the goal of the project was to gain knowledge, skills, and devise new strategies for knowledge exchange between peoples of different cultures, religions, languages, socioeconomic status, levels of education, and life experiences within the Atlantic region. This particular synthesis paper was funded by the and research was funded by Canadian Heritage and had built upon work that was initially funded by the Population Fund Public Health Agency of Canada. It's also, the webcast is built on experience. One objective of the Canadian Breast Cancer Network projects this year is to increase capacity for people to be able to share knowledge. So I think it's important to look at what we know from both our experience point of view and from the research. So the outline for this webinar includes an overview of the research. It also will provide some feedback from Canadian Breast Cancer Network Atlantic consultation, a few reflections on my experience, and then an opportunity for questions and discussion about experiences you may have or questions you may want to ask about. So I'm going to look more closely at this particular research project, and we'll go through it because it was quite an in-depth project and really started to open up some of that mystique that we talked about earlier. So the goals of the project were to deepen our understanding of current knowledge about cross-cultural, and here's a word that gets tossed about quite a bit, KTE. If we were in a CBCN meeting right now, we would be paying a quarter for using an acronym, but it really means knowledge, translation, and exchange. And so every time you see a word or that KTE, that's really what it's referring to. So it's to look at the relevance of existing models and strategies and to work with partners and provincial networks at the Summer Institute, and ASI actually is referring to the Atlantic Summer Institute, to reduce barriers to full participation in Institute programming and to disseminate findings of the project. So we're going to talk a little bit about dissemination at the end of this as well. The synthesis paper itself draws on a literature review, key informant interviews, a national online survey, and consultation with Atlantic Summer Institute networks in 4 Atlantic provinces in making its conclusions and recommendations. A copy of the paper can be found on the ASI website, or it could be sent to you in a PDF format following this webcast if people are interested in reading the full paper. The key research questions for this project were the following. Are organizations who do work with diverse populations using a model for translating or exchanging knowledge and information? That's number one. What are the features of these models and where do I find them, and which model is appropriate for our work? That was assuming that there were models out there. Some of the most important issues for the researcher at that time were clarifying the meaning of some key concepts such as knowledge translation and or exchange and the word cross-cultural. Discovering what terms are used by people who engage in the exchange or translation of information or knowledge with people from diverse populations. ascertaining the existence of models or frameworks, and locating documentation within organizations who engage in the exchange or translation of information or knowledge with diverse populations. So it really was trying to clarify, what do these words mean to people? Are there models out there, and do people actually are they documenting what they do? Are they engaged in a practice and just don't have the time because they're just so busy, or are they actually getting it documented so that we can learn from it? So when the first approach was the literature search, this online survey, key informant interviews, and network feedback. And this is just a cartoon that the researcher had drawn up of what her life was like standing at this library, imagining she was taking on a simple task and discovering it had multiple layers. Just a wee bit overwhelming. The first, then, is the search for published and gray literature. And just so that you know, there was a comprehensive search for published literature, then a search for academic literature, and then a search for gray literature, which is really literature that has not been published and that might be in pamphlet form, might be a report from an organization. So it's not something that probably ever will be published, but it might be a paper that's been released by your health authority or by the Canadian Cancer Society or by Canadian Breast Cancer Network that has never been peer-reviewed and actually made it into a journal. So that search was also comprehensive through access to 63 sites that we thought would probably get us the information. As a result, this is what came out of the literature review. Depending on the discipline or the sector, there's inconsistency in terminology. So, for example, if you were working in the health sector, you might be using words, in health research sector, you might be using words like knowledge translation or knowledge transfer. But if you were working in the education sector, you might be talking about learning. So it's the language is very different depending on where you're located. There are models for knowledge transfer and exchange, and translation and exchange, but not specifically for use with diverse populations. There is a need to clarify terminology and define the concepts to be used for our purposes in our work, but really, when you think about it, it's for work by anybody who's working in a community. We should be wary of seeking one truth, because it seemed like there were lots of opinions, but not necessarily one particular way of doing it, and there's great interest in effective knowledge translation and exchange strategies within the research community. And it seems to be more in the research community where the terminology is used more extensively. The next was an online survey, and it was a 12-question online survey. It was designed to use Ultimate Survey software, and it was circulated on listservs associated with a variety of different topic areas. So health safety, diversity health, social determinants of health, community-based participatory research, health promotion, and adult education. It was online for 6 working days. The goal of obtaining feedback was just to get feedback from about 25 people, and we're overwhelmed with response. So obviously there are a lot of people that were keen to know more about this issue and also to discover what other people are thinking in terms of this language and these words. So 96% of these survey participants had experience working with people in diverse groups. That was interesting. Knowledge exchange was the term identified most often to describe how the exchange or translation of knowledge or information takes place. So 35% of people. The term most widely used or preferred to describe differences is diversity, and more than half of the survey participants do not have a model or framework they use, and the same number do not document the way in which they do this work. So that comes back to the evaluation piece. There is very little documentation on what people actually do, even though we're out there in the practice world. It just gives you an idea of how people responded. And you can get a sense of the number of words that are out there right now about knowledge building, translation, exchange, knowledge brokering, dissemination. No wonder people are feeling somewhat confused and a bit overwhelmed and daunted, I think, in some senses. So what my sense is in looking at that, it is a little bit makes you feel a little bit better that other people also have the same sort of confusion that you might have over some of this language. So further, following the survey, there were interviews conducted over the telephone with 8 key stakeholders, and these are people that had either published articles or were currently conducting research in areas of knowledge translation or exchange, or were working in the field of cross-cultural learning. And again, this learning comes up periodically as a piece of terminology that is worth looking at. Of those key informant interviews, the key findings were this, that there is a difference between knowledge translation and knowledge exchange. That knowledge translation or knowledge transfer usually means that there is knowledge that has been discovered by the researcher that is to be shared with practitioners. And so knowledge translation or transfer is unidirectional. It's coming from the researcher down to the practitioners. Knowledge exchange, on the other hand, has a multi-directional flow. So it can be between the individual, two individuals, two people with different levels of expertise, and the exchange goes back and forth. So knowledge translation has actually gotten a lot of attention over the last 10 years, but it's still evolving. The conclusions are tentative. There are a lot of emphasis being placed on all this research sitting on shelves and how do we get it in the hands of practitioners. And so just that whole area seems to be one that is getting a lot of attention, and you will see soon that one that we don't know a whole lot about, even for all the attention that it's getting. In many senses, it was felt that the outcomes would be better if users and researchers worked together throughout the whole process, that this idea of knowledge exchange may actually be a concept that might work better, but that there's no real simple answer to the whole issue. Out of these key informant interviews came some recommendations in working with diverse groups, and their key recommendations were to build trust, mutual respect, understanding, open communication. They really focused on building relationships, use clear language, honor the knowledge and experience of everyone in the room, include participants, users of the knowledge from the beginning, and don't make assumptions. And so you can see where the people who are actually doing the work and doing the publishing are moving from this knowledge translation top-down approach to one where there is exchange that's going on, and there needs to be reflection and dialogue around the concepts. So after all of this information was gathered, a presentation was given at the Atlantic Summer Institute in 2007 that reviewed the results of the project up to that time. And this was followed, after the presentation, there were group discussions of each of the provinces. There were 109 provincial network members that participated. And they were asked questions about the presentation itself and to think about this in terms of how it would apply to them. And there were notes being taken in each of these groups, and so we were able to compare across the board in terms of what were the common themes. What was interesting, again, is that the word diversity came up as the term that was preferred, that the group strongly felt that we should be looking at guiding principles as opposed to a model or framework, that there are documents within the networks that are out there that can be shared to help us address the issue, but we don't know where they are. They are ones that individuals know about because their organization may have completed some work, but there is nowhere where it's being put together and people are actually looking at it. And that it's important that we share our cultures with each other in terms of interaction. They were very interested in knowing how to address cross-cultural learning. So the interest is there. There's a strong sense of what works and what doesn't, but still wanting to learn more. And they made recommendations. They're not dissimilar to the recommendations that came from the key informants. Remembering that the people who attend the Institute, for the most part, are practitioners. Some of them are researchers and policymakers, but there's a good mix. And their recommendations were, again, respect diversity, have appreciation for differences, don't use formal language, use clear, plain language, practice inclusiveness. All try to be participatory, involve the participants and end users in all stages, build trust, respect, be adaptive, flexible, and go to the diverse communities and talk to the people, build relationships. So not just necessarily bringing people to you, but actually make the effort to go to that context and that culture. So a lot of information, and so our researcher was really, where do I go from here? That seems like a lot. People are telling us there's some kind of clear messages there around the language, but what does that mean for the practice, particularly for the Summer Institute that is trying to be more diverse and open in its approaches? So there was a great consensus then that the next step should be that we develop a strategy for knowledge exchange with diverse populations that unravels the mystery and provides some common ground, because people generally were feeling a relief to know that this language was a barrier for many people and that we just need to get on with it. So there was a recommendation that a plain language guide be developed on how to best develop and share knowledge and information with diverse populations. And that recommendation, of course, came from the research team after they reviewed all of the findings and heard about the consultations. And so there was further consultation, if you can believe it. They recommended a content and then went out to the networks using webinar presentations and gave a background on the research, and then asked people, would developing such a guide be a helpful strategy? What do you see as the challenges for implementing a strategy? Who would use this guide? What would we want the guide to achieve? What's the purpose? What would the guide look like? How would we ensure it gets in the hands of people and organizations who need it? So lots of questions were being probed, and again with that idea that if we're going to work with a group of people who are going to use a product, then it needs to have a lot of input from the people who are going to actually use it. So the recommendations that came out of these consultations were that there needed to broaden the consultation, but it's seen as a critical first step in the development of a plain language resource. And that was to ensure that the final product was flexible, relevant, and appropriate. That the resource should be written in a style that's accessible to all and should be made available in a variety of formats, hard copy, video, books on tape, and languages, including English, French, Mi'kmaq, and Braille, which we often don't think of our books and our resources as being made available in Braille. We do have an increased focus on Aboriginal languages, but we may want to think about some other ways in which we can reach people. Rather than creating a single resource or toolkit, consider building a suite of resources and activities, including workshops, handouts, training guide, at-a-glance and in-depth materials, web-based resources, networks, mentors, etc. And that has really been quite popular and well accepted that would be a good recommendation. The resources should be visually appealing, and stories or examples should be relevant for people of many cultures and or social locations. That a key challenge is keeping the terminology consistent, particularly in light of the confusion that's evident in the literature and among participants, and that it was important that there be a glossary available in the guide. And that in keeping with it being a suite, that a promotion and distribution of the resource should likewise involve various media, multimedia, radio, internet, presentations, and of course this was only a year before Facebook and YouTube and Twitter became really important. So follow-up and evaluation will be needed. We keep hearing that theme of the evaluation because, as you noted earlier, people are not documenting what they're doing, so we don't really know what works and what doesn't work to the degree that we would like it to. What we have done at the Summer Institute as a result of this project is that the board has increased its awareness of the principles and and is busy trying to recommend them in its programs. It would need to and is considering applying for funding to actually work on developing that suite of products that would help people in engaging in exchanging knowledge and sharing knowledge with diverse audiences. So in conclusion, and this is in the paper, a lot of this, and there are kind of highlights in terms of what some of the lay of the land is. But according to the Canadian Institute for Health Research, another acronym, which is the main funder of health research in Canada, knowledge translation is the exchange, synthesis, and ethically sound application of knowledge within a complex system of interactions amongst researchers and users to accelerate the capture of the benefits of research for Canadians through improved health, more effective services and products, and strengthened healthcare system. So that is a definition that you can ponder and make life a little more complicated as we go. So you can see from that definition also that many of the projects and publications reviewed for our analysis suggest that knowledge translation and exchange activities continue to be designed and delivered from the top down. And the end users are involved only in the delivery of information as part of ongoing efforts to improve the uptake of knowledge. So we have a great divide here in that it's almost a paternalistic type of approach to the end user as far as the information that's coming from the researchers, and one that is going to require a real shift if we're going to have, and you can see it happening particularly in the breast cancer community where survivors are engaged more and more completely in conferences, where we're engaged in the partnerships and we're engaged in the research teams. But that is almost unusual in many other fields. So there's work to be done in terms of actually having knowledge exchange rather than the patriarchal approach. There's really time to turn to practice. Like, how are we going to do it rather than just articulating it? Because no definition is particularly helpful right now as a guide to understanding or engaging in knowledge translation activities, because they do emphasize goals and outcomes more than the processes. And so how do you actually do this work? We're not going to find it really clearly articulated in the literature. So when our research team was actually looking on the whole experience and saying, what insights did we glean about practice from the literature and from the consultations? They felt that while respondents rejected the idea of a model, they were still structuring their activities and using many reflective and iterative approaches. So a lot of us who work in communities do use participatory approach and participatory action methods and principles of adult education and learning. And that's language that people can relate to in community. So there is a lot of activity happening there. And because those are the approaches that people in community are using, many are acting as, in fact, knowledge brokers, because their descriptions of learning activities and environments seem to be consistent with knowledge brokering. And when we look at what knowledge brokering is bringing people, researchers, decision makers, practitioners, and policymakers together to help them build relationships, uncover needs, and share ideas and evidence that will let them do their jobs better. That is more fitting with some of the consultations that we have just been experiencing with Canadian Breast Cancer Network, where just this past weekend we had a consultation for Central Region and brought together people from different organizations and different cancers and had an opportunity for sharing and building relationships. It's happened earlier this year at a stakeholder forum. It happened in Atlantic Canada earlier as well. So that approach tends to be one that is happening more at the grassroots level, and those links, again, are needing to be made with the folks who are actually developing the research. Even so, although there's lots of activity happening, it's really there is very little that's known about where knowledge brokering is most effective or how it's most effective. And that's a very interesting point, because we're all doing it, but we're not documenting it. So in terms of evaluation, it's a critical point, because the organizations and individuals who are engaging in particularly the knowledge exchange, but also those knowledge translation, those top-down approaches, have no real frame of reference for evaluating the quality or effectiveness of their work. There is much yet to be known and very little understanding about which strategies are most effective. And there is little evidence about which factors influence the effectiveness of the knowledge translation exchange activities and strategies. A little bit scary, and you see that was probably one of the more alarming things that showed up in the research. The next piece to that was even when we look at the people who are doing the work in the field, not necessarily those who are researching the work, but the work that's being done, there's no such thing as best practice in community-based knowledge exchange. And interestingly enough, the people that we consulted with in our provincial networks felt that it would be very time-consuming and difficult to identify and define best practices for cross-cultural knowledge work. They suggested that it would be more helpful to have examples and stories rather than trying to research best practices that might be too specific to one's context and not applicable to all, but stories and having tools that were more in line with the way people work in community would be most helpful. So most of the respondents, both from the interviews and from the consultations, were more comfortable developing principles or guidelines than with creating and using specific models. And I think that it just kind of highlights some of what you've seen earlier in what the different groups were saying, but it's really a critical one here, which helped to shape the kinds of recommendations that came about for the suite of resources. That there needed to be relationship building among those who have or create knowledge and the end users, that there needs to be sufficient time and resources, and crafting the messages and materials need to meet the needs of specific audiences. And we'll talk about that again, because when it comes to reports that come out of projects or evaluation results, really important that the people who they're delivered to receive them in a form that they can use. So a summary of this particular project is that it reveals significant gaps in understanding about and practice of cross-cultural knowledge, translation, and exchange, that there is confusion and disagreement about terms and concepts, an absence of models or frameworks, and inadequate support for work in this area. And as a result, many organizations and individuals are confused and at loss. To raise awareness about cross-cultural knowledge, translation and exchange, and foster environments and opportunities for capacity building, a suite of resources should be created, and it should be included but not limited to the plain language guide, a train the trainer workshop module, and all of this material needs to be available both in print and on the web in a variety of languages and styles. So if anybody is really has a lot of resources, there are a group of people who would really like to work with you on developing that. So that's, seems a little bit pessimistic in terms of what's out there now, but it does do a few things in terms of pressing the point that we do a lot of work in communities. We aren't documenting it. We do need tools, and we do need to evaluate in order to know what works and what doesn't. Before I move on to my next slides, I'd just like to give credit to this work to Dr. Barbara Clow, who many of you know in relation to her work with developing the profile of services for women's cancers in Atlantic Canada, Annette Penny, who is a researcher, and Kirsten McKnight, who works with the Quaich, who served as editor. So what do we know from all of this? In my language, knowledge sharing equals knowledge exchange. It only works well when you have the two-way. That we share knowledge means that we exchange knowledge. That language can be a barrier if we let it, and that we need to use what we know. So in my practice, I rely on adult learning principles. I believe learning is a two-way process, that each of us brings expertise and knowledge to share, that continuous learning happens through our stories and through the experiences of others, and that we can link research, policy, and practice, and that there's a bit of a cycle there that needs to be in place so that as research comes out, it gets implemented in policy and in practice, and in turn is researched and evaluated, so it informs the next round of work that we do. Here's just a little, I think learning from others is a really important piece, and it just happened that during the consultation in Atlantic Canada this year, that under a project sponsored by CBCN that was Breast and Women's Cancers, Increasing Capacity Through Sharing Knowledge, Skills, and Best Practices, Barbara Claw was invited to make a presentation on ethics review. And that was because a number of the projects had moved to a point where they were really needing that information. So the feedback afterwards was that it was helpful and timely, and it made us feel better equipped to deal with our projects. So that was positive. People were really interested. But it seemed like it would be a really good opportunity to say, what was it that made it interesting? And that's try to see if you could distill some of the elements from that presentation that made it so interesting. It doesn't take a lot of work to do that, but it is one way of starting to document what was it that really made the difference, and what made the ethics presentation useful or engaging. What people had to say was that it used humor, it was concise, snappy, clear concepts and language, visuals, relevant real-life examples. The presenter had good knowledge of the subject. The interaction with the audience kept people involved. The case study allowed participants to apply the principles directly, and that additional resources were distributed. So people were engaged, there was new knowledge to present, but it was meaningful to them and to the work that they were doing, and there was opportunity for exchange with the presenter. So and you can see a lot of these principles kind of showing up here as ones that in the community, in a community-based or in an educational environment, a lot of things are done, and a lot of things work, but are we actually documenting those? And how do we do it? So ideas that I have for facilitating knowledge exchange in diverse groups come really from the experience as an educator and also from knowing from the literature what works and what doesn't, and what we have here from practitioners, and that is establish clear objectives, design a process that engages participants, attend to different learning styles and cultures, engage key people to participate. For example, I was saying to Jen the other day, I might design the process for the consultation, but who you get to fill those speaker slots is critical to how successful the event is going to be. So getting those key people to participate, doing things like supporting travel or childcare or dependent care in order to reduce barriers to participation, creating a comfortable environment, using plain language, attending to the context, making sure everyone's respected and has an opportunity to speak and has a voice. And constantly be thinking about how are we going to evaluate and what are we going to learn? What are the lessons learned so we can improve next time? One of the things that we don't do really well is when we have evaluation results and research results, how do we get them out to people? And this is where either we tend to impart it as a presentation at a conference, or we don't do it at all. We publish in academic journals that some people never can access. So one of the things that they're suggesting, if you look at those recommendations, is that when we're thinking about how to disseminate findings, that we involve users from the beginning. And we have them reviewing the research or evaluation, making some recommendations, looking for a variety of ways and variety of vehicles, and perhaps even newsletters, some synthesis, some different ways that we can get the information out. But getting to understand what is our audience and who are we trying to reach means that we're involving people from the beginning to help to develop those messages. And that people who are involved throughout a project, throughout a research project, receive the results in a form they can use and understand so that they also can learn and they also can change their practice. one of the things we started out with in this presentation was actually looking at proposal writing and the confusion sometimes because the funders use words like knowledge translation or exchange in a request for proposals. And so my sense, and these are my ideas only, so I'm very interested in hearing if you have any thoughts about this, is that when it comes to proposal writing, that we can ask funders for clarity around the terms they're using. And if they don't give us an answer, then we need to define the terms ourselves and put that in our proposal. And then when we describe the activities that we're going to engage in, we're basing it on a definition of what knowledge exchange is, or what knowledge translation or knowledge brokering is. And if we're going to talk about sharing knowledge, then we want to make sure that it's clear that we are actually going to be doing just that we're going to be engaging people from the beginning, and that we are actually sharing rather than presenting knowledge like I am right now to talking at you, which is very content-driven, and we're not really getting into the dialogue that is most helpful, but it's just the way it is right at the moment, and hopefully we'll have some discussion following. That you develop a proposal based on your understanding of those terminologies, and that you build in evaluation. Can't stress it enough. I think that evaluating what we do will build knowledge in how we can best share knowledge, and it will assist us to do a better job in the future. And the rest of the time, we probably do it naturally and we're all our own experts, but in order to develop that skill in a broader sense, it would be really helpful if we could articulate exactly what it is that works well. So that is drawing to the close of my presentation, and I just would love to have an opportunity to hear from you whether this story was helpful. Do you feel any less alone knowing that many people are confused? Do you think you might feel more confident in asking questions of funders, and whether from listening to the presentation you have some new ideas as to what you can do to be more effective in sharing knowledge? So I'd like to open it up for questions, and then I have another slide where I'd like to ask you for some of your ideas and thoughts, but I know that the best way for us to do this just now is through the chat feature. So if you can give me some feedback on the presentation, it would be really helpful. Considering my stress on evaluation, really like to get some feedback. So thank you very much.
Thank you, Patsy. So we'll just give everyone a minute or two to type in any questions or feedback that they have for Patsy into the chat function, which is at the bottom of your screen. And thank you for transferring your knowledge to us, Patsy.
Thank you. I'm hoping we get a few questions or comments here. It would be great.
And I should also mention right now there will be an evaluation that I will send out to everyone who has participated in this webinar later today. It's actually just a link that you can click on. It takes just a couple minutes, and it can be done online. So I will forward that off to those of you who have participated later today, and if you could take the couple minutes to fill it out, I know I would appreciate it, and I'm sure Patsy would as well, to get feedback from you on this webinar.
Thank you very much. I'm looking also if you have any ideas that have sprung to your mind about how we can best use this information to navigate the world of proposal writing or share knowledge. Please send it my way or in through the evaluation. And looks like at this point there probably people are trying to absorb quite a bit. So if there are no questions, I would just like to thank you very much for joining the webinar, and let you know where you can contact me, and also let you know that the Atlantic Summer Institute is going to be held August 17th to 20th on PEI, and theme is Innovation and Collaboration, Building Resilient Communities. So if you're at all interested, you can find the website. And I believe we'll be sending this presentation in a PDF format as handout, or is that?
Yes, Patsy, I can forward that along with the evaluation link.
Okay, I can.
And if you're listening to this webinar after the live webinar on demand, you can email myself, Jen McNeil. So it's J McNeil, McNeil @cbcn.ca to request a copy of that as well. Or Patsy will put up her her contact information on the screen as well, and I'm sure she'd be able to help you out as well if you're unable to reach me.
Okay, Jen, I think that's probably it for today's webinar.
Okay, I'm just going to put your contact information up on the screen, Patsy, if that's all right.
Yes, for some reason the slides aren't moving, even though I've pressed next, they weren't moving. So thank you.
So there's Patsy's contact information. Thank you, Patsy, for joining us today and presenting this information to us. And thank you for those of us who have joined it and for those of you who are listening on demand afterwards.
Thank you, ladies and gentlemen. That concludes this webcast.